Hello, and welcome to Preemie Chats, a place for parents and healthcare professionals to gather, share stories, and learn from each other. My name is Jenna Morton. I'm one of 3 co-hosts for this series on behalf of the Canadian Premature Babies Foundation. I'm a career broadcast journalist and mom to 3 NICU grads, 2 who were preemies, twins who were born at 32 weeks and are now 11 years old. And I'm coming to you today from Mi'kma'ki outside of Moncton, New Brunswick. Well, Preemie Chats is the creation of the Canadian Premature Babies Foundation, or CPBF. The foundation is a parent-led charity that helps families during and after their NICU time through education, support, and advocacy. You can see our website there on your screen, canadianpreemies.org. I hope that you'll take some time to visit after our discussion today. You will find all kinds of resources on the website, links to our previous Preemie Chats, our podcast, downloads, all kinds of information. Most importantly, what you're going to find there is a community of parents and professionals who are working together to help our children thrive. Well, this is a parent-led organization, and very much we want to hear from you, whether you are a parent or a healthcare professional or a grown preemie who's tuning in. Please take a moment in the comments to let us know where you're watching from and what brings you to join us today. Also, I would encourage you throughout today's presentation, if you have questions or an experience you'd like to share, please feel free to do so in the comments. We'll have a chance at the end of today's presentation for a little Q&A. So please feel free to drop things as we go through in the comments section. Well, today is a topic that I think probably ranks up there as one of the most talked about things when it comes to infants. Of course, that is sleep. My guest today is going to help us navigate the topic of sleep for both preemies and their parents, and just help put our minds a little bit at ease about this tricky subject. Dr. Elizabeth Keys is a registered nurse and assistant professor in the School of Nursing, Faculty of Health and Social Development at the University of British Columbia, Okanagan campus. She also holds adjunct positions at Dalhousie University, the University of Calgary, and she is the Michael Smith Health Research BC Scholar and lead investigator for the Slumber Research Lab. Welcome to Preemie Chats.
Thanks, Jenna. It's wonderful to be here. I really am so pleased to have the chance to participate in this parent-led series. It's my background is in community health nursing, and so I love being able to connect with different communities. Shall I go ahead and share?
Yes, I would love for you to start your presentation. Thank you so much. I'm really looking forward to learning along with our audience today.
Wonderful. Thank you. So welcome, everyone. Today I'm going to talk about sleep health in a NICU and beyond for infants born preterm, but also thinking about how it compares to infants born full term, because that's, a lot of the research has been done with babies born full term. And historically, sometimes the infants born premature have been excluded from some of the research, but there are pockets. So I just want to say thanks, Jenna, for introducing me and my role. I'm coming to you today from the Okanagan in British Columbia, which is the traditional, ancestral, and unceded territory of the Syilx Okanagan Nation. And I just thought I'd start off with just a smattering of who I am and where I've been and how this has shaped kind of the coming to be able to give you some of this information today. So, I was a baby once, and not a NICU grad. After I grew up, I worked as a public health or community health nurse in Calgary, Alberta, after going to the University of Calgary for my nursing education. I continued on at the University of Calgary to do my PhD. I had a baby, full-term baby, but a baby who did not like sleeping very much and was very unsettled. And that really sparked an interest to, based on my personal and professional experience, to start to try to figure out how nurses in particular, but also the healthcare system could work towards supporting parents in managing kind of infant sleep problems or disturbances or just coping in general. I went on and did a stint at Dalhousie University as a postdoctoral fellow to learn a little bit about e-health interventions for pediatric sleep before I kind of landed here in the Okanagan. There's a picture of the arrow balsam root flower, which is a nice little sign of spring here that I am already looking forward to on this gray day, where I lead the slumber research lab. And slumber, kind of the tagline for slumber is sleep solutions to promote better early childhood relationships. So much of my research is focused on early childhood, helping families understand more about sleep, trying to develop interventions and implement interventions that help them do that, but also with a thought towards how sleep can interact with our family relationships. So today, to get a little bit more into the specifics of what I'm hoping to talk about today, I talk a little bit about sleep health in families of babies. I'll give a little bit of overview of some of the research that's been done of sleep in the NICU and sleep after the NICU for premature infants, and then beyond the NICU. And when I say beyond, I mean, up to 12 months post-natal age, and also compared to full-term babies and how we might be able to make comparisons to full-term babies, and then talk a little bit about promoting infant sleep. So this is just a quote from one of the parents that was in, or was a potential participant in one of my research studies. And I think I always like to start off with this because it acknowledges some important things. So one, she's saying being a mom is tough, and I feel so strongly that infant sleep education is important because we don't know how and why would we. And I think this kind of highlights that there's a gap in health services in terms of helping prepare parents for sleep with a newborn and baby. And then this next bit is, I've bought books and books and read them all, and I'm still in this position. And I think that's really important to recognize because I think parents come, if they are having difficulties with sleep, they usually do a lot of research and reading and try really hard to figure out it on their own. And so when we're talking about sleep, I think it's important to recognize that most people have done tried to get a lot of information on their own already. And then this last bit about, it's even more accurate to say that I created kind of the sleep problems with the lack of education and knowledge of the topic. And this, I think, is the thing that sits with me a lot of the time, because it's kind of communicating a sense of blame, or like that it's all their fault. And really, I can see that a lot in parents sometimes. But what I think is missing is the supports. And so that guilt, I think, is part of a feeling that I also try to address when we do some of the work that we do. So more and more, sleep is being recognized as a foundation of health. So typically when we think about healthy behaviors, it's always been physical activity and diet, so diet and exercise. But more and more, sleep is being considered as part of that foundation of health. And there's good reason for that. It can influence physical health, and this is across the lifespan in terms of how people cope with pain. It has associations with weight, mental health. So sleep problems in and of themselves are mental health problems, but then stress can also exacerbate or worsen mental health problems. Mental health problems can also worsen sleep. And so sometimes things will be, I guess, predictive of other mental health concerns. Sometimes they'll come after other mental health concerns, and sometimes sleep problems will kind of flow along with mental health concerns. So they're really tied together. I think anyone that's had, a bit of sleep deprivation will be able to identify that maybe they're not their best self all the time, especially in their relationships. Usually they're don't have as much patience. And so, satisfaction with partners and parenting can sometimes be a little bit diminished if you're sleep deprived. Sleep can help with regulation of emotions. And then particularly for children, but also for adults, it has links to cognitive and development, so growth and development in terms of learning and executive functioning. So I think it's really important is the short stick of things, but it's also something that should be supported. When I talk about sleep health, there's kind of a foundational concept, and it's not just about the duration or how much you sleep, but it's about when you sleep, so your appropriate timing. And it's about if you are in bed, for instance, how efficient is your sleep? So are you tossing and turning and up 1 or 2 hours out of your 10-hour sleeping time? Because that's probably not as efficient as if you're in bed and fully asleep for, say, 9 hours, where you would have 100% sleep efficiency, which no one has. But hopefully that demonstrates the idea of sleep efficiency. So that's how many night wakings you are having, how long it takes you to fall asleep, how long you're awake during the night. Then some other kind of key points about sleep health is, are you sleeping enough? Is your sleep, are you getting enough quality sleep when you're trying to sleep, that you're able to be alert when awake? And then that also links into sleep health, considers your sleep satisfaction and quality. So are you satisfied with the amount and quality of sleep that you're getting? When we think about sleep health in families of infants and for children, it's really important to think about also the sleep behaviors. So, is there sleep routines? Is there, where are people sleeping? Are they sleeping in safe locations? And then, because particularly for infant sleep, it's not just about the infant sleep. There's quite a interconnectedness with the parent or caregiver sleep, and that can be influenced by other people's sleep in the family. So sleep health really, as you think about for infants, you also have to consider sleep, of the parents. And sometimes the sleep of the infant is disrupting the sleep of the parents. Sometimes it's other children disrupting the sleep of the parents. Sometimes parents might have their own sleep disturbances or problems, such as insomnia. And so, while not a ton of my research is specific to sleep in the NICU, I did do kind of an overview of the literature here. And so, while in the NICU, infants born preterm often will have irregular sleep schedules, which can kind of change the timing of their sleep. So that's one of the components of sleep health, is the timing. They might have increased motor activity during sleep. They might have reduced sleep duration, especially if there's lots of procedures or things that they are being woken up to do. And they have a lower arousal threshold. So that means that they don't need as much stimuli to wake up from sleep. So those are some things that can happen in the NICU for infants born preterm that can kind of disrupt their sleep or kind of reduce their overall ability. Now, many of these things, of course, need to happen because it's part of the medical care and they're very important. But it's also, I think, important to recognize that their sleep might be at risk of being poor quality. The other thing that I think is really important to do, and this is from a study that was done, I think, in Ontario, actually, for is to think about the sleep of the parents as well. So sleep disturbances for mothers of infants who are in the NICU is associated with increased stress, increased depression symptoms, and breast milk expression, which of course, again, is another thing that's really helpful for babies in the NICU. But I think it is important to recognize that it is can contribute to poor sleep in parents. And so some other things that were associated with mothers who had sleep disturbances, so above a certain cutoff, was that they spent more time per week in the NICU, so about six hours more than people who didn't have or mothers who didn't have sleep disturbances, and they're more likely to have other children at home. And so this is a good example of something that's not modifiable. You can't not have other children at home if you have them. But again, just really important to recognize that, if this can lead to kind of higher likelihoods of parents also having sleep disturbances. And so maybe we need to find other ways to support them. Another couple of things that have come up in the literature is that, medical care in the NICU may lead to different circumstances that kind of is different than safe sleep recommendations for when you go home. And so there can be a bit of confusion and distress between, being prepared to be discharged and then being ensuring safe sleep environments at home. And it is important because babies who are born preterm are at risk of SIDS. And so what the recommendation is for while people are in the NICU is that, when possible, safe sleep practices should be practiced, and that there should be some parent education on safe sleep environments before discharge so that people aren't feeling completely unprepared when they're being discharged. Another kind of key thing that has come up in terms of some of the recommendations from reviews of the literature is that it is helpful to incorporate sleep assessments into daily routines and assessments of kind of other daily activities, and to be able to kind of have an idea of that. So you don't know if it's a problem if you're not monitoring it. So that's something that can be helpful. In the NICU, there is some mixed research on whether or not interventions can improve sleep for preterm infants in the NICU. So the ones that probably have most consistently shown to be helpful would be mattress or positioning interventions, cycled light, so making sure that at nighttime it's dark and in daytime it's light, has had mixed effects. So some studies have shown that it has been helpful and others have not. There hasn't been any, when we look at kind of synthesis of the research, there hasn't been demonstration of any helpfulness with individualized developmental care, music, or massage therapy. But so it's still mixed, but there is growing research being done, and so this is a good thing, but coming with the limitation that probably more research needs to be done. There is one recommendation from a systematic review that talked about how, it would be helpful to protect infant sleep by postponing elective care if the infant is sleeping when possible. This is a little bit, so oftentimes parents want to know what to expect with sleep and is their baby sleeping kind of within the norms. And so I wanted to share with you today some work in progress that I'm leading in a collaboration with researchers who conducted what's called the Pregnancy During the Pandemic cohort study. So they're led by Jerry Giesbrick, Catherine LaBelle, and Dr. Leanne Tomfor-Madsen. So they have a huge cohort study of parenting during the pandemic, and so now the babies are coming up to about 3 years of age and continuing to collect data. And I've been leading some analyses on the sleep data that they collected. So this is kind of cohort data, so it's not differentiated between preterm infants born preterm versus infants born full term, but it I just wanted to kind of share a snapshot of what parents are reporting at 3 months and at 12 months is when we have it. And this kind of fits into some of those sleep health categories. So around 3 months, in 24 hours of a day, the average amount of sleep is 13.7, but it does have a range. And so I think this is really important when we think about sleep kind of indicators, is that just like your growth, your baby's growth chart, there's going to be, some people who sleep a little bit more and some people who sleep a little bit less. It kind of, it is a little bit of a range rather than an exact number. And so the range for total sleep duration at 3 months is about 11.5 hours to about 16 hours. And that decreases a little bit or tightens up a little bit at 12 months, where the total sleep duration is about 13 hours. And that, again, there's a range that's from 11.7 to 14.7. You can see that when we look at nighttime and daytime sleep kind of separated, there's a lot more daytime sleep at 3 months, and that kind of decreases by 12 months, and nighttime sleep increases a little bit. The longest sleep, so this is a question where we ask parents, what's the longest chunk of time your baby sleeps, can range from 3.7 hours to 8.3 hours at 3 months, or 5.9 hours to 10.4 hours at 12 months. So like pretty big ranges. And then number of nighttime wakings, on average at 3 months, about 2 nighttime wakings per night, whereas at 12 months it's closer to 1. Typically, like when we think about time to fall asleep, we're looking at kind of typical ranges of about 15 to 30 minutes. And so this at 3 months is about 18.6 minutes to fall asleep. And at 12 months, it's about 9 minutes to fall asleep. But again, pretty big ranges. So 2 to 35 minutes and 0 to 18.5 minutes. However, most babies do, when we think about the amount of time that they're awake at night, most of them it's not more than 1 hour. When we think about what's related to those infant sleep kind of metrics, so I thought this would be very interesting. So gestational age, gestational age of the baby is related to sleep kind of metrics at 3 months, but by 12 months that has kind of dissipated and gone away. Like you can't detect differences anymore. There's no association. The other things that are also related to infant sleep is infant temperament, so parents' perceptions of infant temperament, parent anxiety and depression symptoms, parent intolerance of uncertainty. So if you don't like to tolerate uncertainty, it can be related to infant sleep. Social support is related to infant sleep, so the amount of social support usually you have can report better infant sleep. And then being a racialized parent is associated with poorer infant sleep. So I wanted to also collect a little bit of research about sleep after the NICU. And this is kind of summaries of research that has looked at differences between infants born preterm and full term. And so the research is mixed. There's been some large studies that have shown, for the most part, there were no differences. There's a longitudinal study that showed that there was no differences up to age 10. But then on the flip side, there has been research that's shown that infants born preterm are more at risk for later sleep-related breathing disorders. They might have longer longer sleep, but then they might have more night wakings at 6 months. And again, that loud, noisy breathing, which might be related to sleep-related breathing disorders, and parental ratings of sleep problems. So parents are more likely to rate their child's sleep as a sleep problem. There's some differences in kind of parenting behaviors for sleep. So some studies have reported that preterm infants were more likely to be held to fall asleep rather than fall asleep on their own. And then at even 12 to 36 months, that parents were more likely to rate their sleep as problematic. There's been, again, consistent with that kind of more problematic sleep, kind of global sleep problems were more likely in preschool children born preterm, and children born extremely preterm did have different, like, notable sleep habits at 11 years. So there's some evidence for some differences, but again, there is mixed research. So again, another area that probably needs to continue to be researched. So what can you do about it? How can we promote infant sleep? Well, the first thing I want to share is that just like eating and pooping, you cannot control your infant's sleep, how much they get. You can set the stage for them to sleep, but even as adults, if I said I was going to give you $1 million if you could fall asleep for right now, you couldn't do that. It's not something that you can control very easily, which can be challenging when there's so much uncertainty. So, but what does cause infants to sleep? And this is pretty consistent for infants versus adults. So there's two kind of big drivers. One is this idea of sleep pressure, or how long a person has been awake. And in the newborn period, this is the main driver of sleep. So in the newborn period, typically we don't see a lot of sleep habits being formed, because babies aren't very aware of their environment as in those early weeks and months. As they grow and learn that there's things happening around them, and they can learn to kind of connect the dots and the routines with, okay, now this is something that's happening with sleep, that that may change. But in the newborn period, it's kind of that sleep pressure. Because they certainly don't, anyone that has had a newborn certainly knows that they do not have a circadian rhythm, which means that they're sleeping more during the night and less during the day. And so the circadian rhythm becomes what we call entrained by environmental cues. So that's light. And that's why some of those interventions in the NICU were thinking about, lighter lighting conditions during the day and not at night. And by hormones, so by cortisol and melatonin. There is some very limited evidence that fetal rhythms might be synchronized to maternal rest activity cycles during pregnancy, but the research is a little bit weak. And then in order for people to fall asleep, then usually they need the right environmental conditions. So it can be hard to fall asleep, especially for adults during the middle of the day when there's light blasting in through the window. So kind of those are the first two are the things that really drive us internally, and then the setting needs to be right. So I have a little question here, and this is postnatal age. So by what age has the circadian rhythm usually developed? So in utero, 2 to 3 months after being born, 12 to 18 months, or 11 to 13 years. So I'll give you just a second. You could maybe even pop it in the chat what your guess is. But I won't keep you in suspense any longer. It's 2 to 3 months. So the circadian rhythm is not well developed in newborns, and it usually starts being developed by 2 to 3 months. Again, this is a range, so it might be a little bit longer. Now, for infants born preterm, you might need to be thinking of this as the corrected age. Okay, it's not an exact marker in terms of at 2 months or at 3 months, they'll start to be having circadian rhythm established, but that's usually around the time that it is. Our internal kind of body rhythms or circadian rhythms is, I mentioned they're kind of controlled by hormones. So melatonin is something, and so that matures at about 2 months corrected age, daily rhythm into like a nighttime, daytime type of thing. It's going to be delayed in preterm infants. But in pregnancy, that's how it can pass to the placenta. So it's not a new thing for the baby, but their system doesn't really get going into producing it until a couple months after being delivered. Cortisol production also goes into kind of a day-nighttime rhythm that's usually observed around 2 months. And then temperature, we do start to see like changes in temperature. So those are all kind of the drivers, the internal drivers that help regulate our internal body rhythm. When we think about promoting infant sleep, I like to think of it as a kind of a stepped model. So you start off with step 1, then you move on to step 2, then if you need to, you move on to step 3, and then if you continue to need support or experience difficulties, then step 4. And so I'm going to go through that through those steps now. Step 1 is kind of thinking about age-appropriate sleep patterns, and kind of the biggest, I think, the most important thing for parents of infants born preterm is to think about, you might need to think about the adjusted age or the corrected age and where your baby's at, because even if they're 6 months postnatal age, their system might not be fully developed as a 6-month-old infant compared to full term. So I wanted to show these things. I showed a little bit about kind of Canadian data before, but this is some other data of like age appropriate sleep patterns. And so you can see, in those first 2 months or very newborn period, there's a huge range from 19 hours to 9 hours. Most people are going to be in this kind of middle section, again, just like that growth chart that you may have seen for your baby's weight monitoring. So it's a big cluster usually around in the middle. So you start off with kind of lots and pretty wide variations, and then over the next 36 months, it kind of tightens up a little bit and evens out. And then here we have another kind of synthesis of different research studies that's showing kind of there's a big range. But in 2 months, 0 to 2 months, it can be anywhere from 8 to 22 hours of sleep. So big ranges. Usually most people are kind of clustered around that middle section. This is just another kind of way of showing how sleep changes over those first couple years. So less nighttime sleep, especially in the first few months, and then that evens out up until about 36 months. And then in daytime sleep, again, pretty high ranges, and then increases a little bit, and then becomes a little bit more stable. This is something I always think is really important, because lots of times one of the first questions parents will get when they start taking their baby out and about is, oh, are they a good baby? Are they sleeping through the night? And my response to that always is thinking about, what do you mean by sleeping through the night? Because people think about that very differently. It can mean like you're sleeping, you got a 5-hour chunk from midnight to 5 a.m., or you're just getting an 8-hour chunk anywhere kind of in that nighttime period, or maybe it's more like mirroring adult sleep. So like from 10 to, I can't see if that's 6 or 8, sorry. But kind of more mirroring that adult sleeping schedule. And so this is looking at, how many what percentage of babies meet that criterion or different criterion for sleeping through the night based on age. So again, you need to correct this for preterm babies born preterm, but around 6 months, we can say, depending on your definition of sleeping through the night, anywhere from 70% to, we'll say 50%, or maybe it's 75% to about 50% of babies are sleeping through the night. So that means like 25 to 50% are not sleeping through the night. So it's pretty developmentally appropriate for babies to not sleep through the night. Another thing that's important to consider, because every family is different and so they might respond to infant sleep patterns differently, is if the parents are perceiving if there's a sleep problem. Most of my work is in intervention development, and so I want to create interventions that respond to parental perceptions of infant sleep. So sometimes some research will focus more on like exact measurements of infant sleep. But for me, kind of a parental perception of an infant sleep problem or difficulty is kind of indicative that families should be supported in a bunch of different ways. So in Canada, based on that cohort study that I mentioned earlier, about 50% of parents at either 3 and 12 months are saying, no, sleep's not a problem at all. About a quarter of parents are saying, yeah, it's a kind of a very small problem, like it's maybe a little annoying, but those parents are usually doing okay. Then about 17 and 15% will say that it is a small problem. And then about 10% of parents at either 3 months or 12 months will say that it's either a moderate problem or a pretty serious problem. And so if you're feeling like your infant sleep is a moderate or a very serious problem, it's probably a good indicator that you could benefit from reaching out to your primary care provider or thinking about different ways to support your infant sleep or get the sleep that you need as a parent. One of the ways, so once you kind of are able to have a look and see, okay, is this just developmentally appropriate and we just need to wait it out, maybe get some more social support so that parents can get the sleep that they need. Once that's kind of looked at, the next step would be to think about healthy sleep promoting behaviors and routines. And routines are always they're just good in general. They're good in general for both infants and adults. People thrive on routines. And so there's been some research, and this is research that has not been done with preterm infants. Usually a lot of the infant sleep research, like intervention research, excludes infants born preterm because it's another variable that people need to account for. I think it is getting better. Certainly in my lab, we are trying to be more inclusive of developing interventions that are good for everybody. But in studies of full-term infants, they found that implementing a consistent bed routine really can improve infant sleep. However, it needs to be implemented pretty consistently. And from one of my studies about how parents implemented interventions, I think this was a dad that really put it quite frankly, like it's just a catch-22 because you want to get better sleep, but you're so sleep deprived you can't see and think through like the long-term results. Like you want to see it right away in terms of improvements in sleep, but it really does take a bit of patience and consistency. So my response when parents are asking about like what should their bedtime routine be, it's pretty much whatever you think you can be consistent with across caregivers if there's multiple caregivers, because the more consistency there is, the more that the baby's going to be able to kind of pick up on that and start to entrain their body to learn that it's time to sleep. You don't need to do this right away as a newborn, as a parent of a newborn, but usually around 4 months or so, it's probably a good time to start thinking about sleep sleep routines and thinking about what is sustainable for your family. The other thing that we can think about kind of in terms of healthy sleep promoting behaviors, Dr. Penny Corkum came up with this ABCs of sleeping. This has been more for ages children 1 and above, but we have done some work to kind of extend it down into the infant age group. So age appropriate bedtimes and wake times with consistency. Schedules and routines are good. Thinking about healthy sleep locations and safe sleep locations, making sure, this is more appropriate as children get a little bit older, but is still applicable for babies in terms of, are they getting activity and are out of their swing or their car seat and able to move around. Thinking about diet and how that may affect things. There's some research that's coming out that through BC Children's Sleep Clinic that low iron can be a risk factor for restless and disrupted sleep. No electronics, and although we don't see babies necessarily on their iPads as much, parents sometimes are, so it's helpful to not have electronics around even for parents when they're doing the bedtime routine. Thinking about positive approaches to interactions and approaching it with a positive perspective. Independence, thinking about independence when falling asleep, and I'll talk more about that later, as appropriate, like developmentally, that the needs of the child are met, including their socio-emotional needs, equals great sleep. So those are just some things to think about in terms of general guidance on what is going to help shape some healthy sleep behaviors. Oh, I think this was a duplicate. The other thing that can be really helpful, and depending on your experience in the NICU, it may have talked a lot about this in terms of cue-based care to build routines. Some of my work has looked at parent-child interactions and how they might be disrupted by sleep difficulties. We know infants born preterm, it can be a risk factor for, they might not have super clear cues all the time. And so it can be hard to read them. But the cues, you can have subtle cues, which are early kind of cues that may need to signal for sleep. And they usually cluster and build up just like feeding cues would. And so, it's a little bit easier to catch babies in this state of like early sleep cues rather than late cues, which is, when they're crying, they're very irritable. As a parent of a newborn and even of a older baby, they're not able to completely control their states. They can't regulate their states by themselves right away. It's kind of mutual regulation. And so it's easier to be watching for some of these earlier sleep cues and know, okay, now I got like 10 minutes, 15 minutes of their window to be able to put them down before they move into this more kind of later or potent sleep cues that then you have to work a little bit harder to bring them down to a calmer state so that they can fall asleep. So kind of these ideas of cue-based care to build routines and learning to watch your baby for their own unique cues that tell you about sleep is kind of a little bit of detective work and a little bit harder to do sometimes with infants born premature because their cues might not be super clear. So oftentimes that's as much as families need, like they just keep going with the routine to kind of set that predictor, and lots of families are okay with that. They don't need any more. If it's not working and you're still struggling, then you can start thinking about more behavioral-based strategies. These typically are more focused on teaching children different ways to fall asleep. So a very common way to fall asleep for lots of newborns and babies is kind of feeding to sleep. and it's a learned behavior. And so at some point, in the newborn period, that was probably a very sustainable kind of behavior to do. But at some point, especially for breastfeeding people, if they're the only ones that can put the babies to sleep because that's the only way the babies have learned to sleep, you might need to teach them some different, what we would call sleep associations of how the behaviors that they're used to doing to help them fall asleep might be, you might need to add some more and then remove some of the ones that are not sustainable. And there's a range of approaches for that. It can be very, very gradual, where you're just building skills and kind of slowly taking away things that are not sustainable, to more direct kind of approaches, which would be like the typical cried out approaches. These are not recommended until after 6 months of age. And I would say, you'd want to think about corrected age for that for infants born preterm. The thing that I like to approach this is to think about what's sustainable for sleep for your family. And this might change as your baby gets older. It might change if with other children or other responses. But I think this is a pretty personal kind of decision for families to think about what is sustainable for them, because parents, you want to do the best for your baby, but you also want to make sure that you're taking care of you. Now, if you kind of think about that or are struggling with those things, I think that it's helpful to think about, not some people might need more advanced assessment and care because there might be underlying issues that need further assessments and support. So, for example, infants born preterm are more at risk for sleep-related breathing issues, maybe with weight and feeding difficulties, and those can you can't fix that with routines, right? So they might need further medical assessment. Sometimes there's mental health concerns in the family, and so you might need to work through some unhelpful thoughts or some kind of all or nothing thinking, or of ways of thinking about sleep, either for yourself or your baby. And so this is where additional assessment or support from like a family physician or nurse practitioner, pediatrician, clinical psychologists, occupational therapists are doing more and more sleep things, or a sleep specialist. So I had an image here of all the Canadian pediatric sleep clinics and labs in Canada. Many of them focus on like sleep related breathing disorders or other kind of more medically based disorders, not so much behavioral sleep problems. But if you have multiple kind of risk factors or medical concerns, sometimes this can be a good thing to advocate for. I found that some people aren't even aware that there's sleep clinics in Canada through usually affiliated with the Children's Hospital. So I'm going to kind of wrap up here. I know there's, as Jenna said, it's a pretty hot topic, sleep in infants. We've done studies that, it's one of the top 10 research priorities for parents. And so it is a large part of my research program. If you're wanting to think about kind of other webinars to watch on sleep or participate in research studies, there's a newly formed Canadian Sleep Research Consortium that is kind of aiming to be the one-stop shop for the public, researchers, healthcare providers to connect to. We're also doing some studies that are thinking about how we can provide more education and training on sleep in early childhood. So that's a good spot to keep an eye out for that. The Pediatric Sleep Council is an American-based council, but they have a lot of resources that are pretty credible, developed by researchers and clinicians, babysleep.com. And then here's just a little bit of information on the Sleep Solutions to Promote Better Early Childhood Relationships lab that I lead. And we're both the Early Childhood Hub for Sleep Across the Lifespan team grant in Canada, which is led by Dr. Penny Corkum at Dalhousie. Better Nights, Better Days is kind of a online program for older children. And then I also involved in a community engagement pillar for sleep health equity. So we're doing a sleep priority setting partnership on what the research priorities should be in Canada with an equity kind of orientation. So if you're interested in kind of following that along or being involved in any of these, you can feel free to reach out. And I think with that, I'll just say thank you. Thank you to the Preemie Chats folks for inviting me, and to the funders and my team. So one of the wonderful things about the Okanagan is you get to have your lab parties at the beach. And so this was something at the end of the summer there, but have a wonderful team, including Dr. Jelena Komenchek, who's a postdoctoral fellow, Taylin Michon, who's a research coordinator, Matab Matin, who's a PhD student, and Nikki Sorashashkari, who's a Master's of Nursing student with us. So with that, we'll wrap it up, Jen.
Thank you so much. I was like furiously taking notes, even now that my kids are older. There was so much great information in that presentation that I'm sure people are going to be coming back to and examining some of those slides in detail. I know I was looking at some kind, this is fascinating. I think as a parent, even now, it's still so important to have those reminders of those ranges, right?
Okay.
So often the parenting books or, the people that we talk to in person or we follow in line talk about, oh, my baby sleeps through the night, or, oh, my baby sleeps so long. And like you say, the sleeping through the night means so many things to different people. And then when you look at that range of what is within normal parameters, there's so much there that I think it's a good reminder for us all the time to stop and think about that.
Yeah, there's also quite a bit of individual, like night to night variability in sleep too. So that's typical. And so it's probably not, I don't know, the sweet potatoes that you fed your baby the first time that made them have, there's just naturally a lot of variability over, in sleep from night to night. And so again, it's all about the range and kind of, looking at the ranges and the averages. And
we do have a question here from Sabrina, who's been watching with us today, wondering if there's any kind of knowledge on why preemies have certain sleep issues and whether there's been any research done, is it from the NICU environment that leads to maybe some sleep issues, or medical history, or a combination. And I had the same kind of question, like how much research do we have at this point looking at factors like this? Do we know yet the answer to questions like this?
So the answer is probably it depends. So it's pretty complex. There's lots of things that come together. There's probably an element of like babies when they're in utero are sleeping a lot. And then if they're born early, they're not sleeping as much. So there might be something that happens that's kind of in the mix with that. There might be something that's a little bit to do with the environment. However, like some of the intervention studies in terms of like the cycling and the, what helps improve sleep is, mixed. And so I would say we definitely do need more research. I can say, like, as children get older, all our brains are wired a little bit differently. So we're all a little bit different in terms of what will work and what won't, and our natural sleep needs. But as children get older, probably the more behavioral kind of in the environment plays a larger role than kind of innate. However, some people are just wired a little bit differently, and so they might just not be like, some people are great sleepers and some people are, very light and very sensitive sleepers. And so how much being born preterm or being like how much that time spent in the NICU we don't know yet. So I would say this is an area that definitely needs to be more research done.
Yeah, and I know earlier in our discussion earlier, when your presentation was going, Sabrina had brought up, in the comments, the sounds of the NICU. In some NICUs, it's especially at certain times of the day, can seem so loud to parents, and we wonder, what the impacts of that are on sleep. And I was wondering, on that point, if you could just talk a little bit about what we know in terms of, is it really, does it have to be quiet? Does it have to be dark? How much do those environmental elements play into our ability to sleep?
So in some of the research that I kind of compiled today, I think infants in the NICU have lower thresholds, like arousal thresholds, so that like they wake more easily with less stimulation. So that noise is probably something to consider. However, lots of babies can habituate to noises, and so that's why you can see a baby, when they get home, they can sleep through the toddler screaming around or running around or crying or complaining about we don't have chicken nuggets. So there probably is an element to that, but and again, like, what's the harm of trying to reduce the noise? It's probably not going to hurt them very much. So it might be something that's helpful to do. It just, I think we do need a little bit more research on that in terms of how it impacts their sleep. It might impact other things like hearing and that sort of thing. But as I mentioned, like, I'm not familiar with that research.
Like you said, I think there's so much that could still be learned about this, but also I feel like sleep must be such a hard thing to research, especially when it comes to infants. It's not like you can ask them what's happening, and you're trying to rely, at best on secondhand information, really, from, the adult who's in the environment with them. How do you go about conducting this kind of research?
That's a great question. So, yeah, usually, like, the baby doesn't have a problem with their sleep, right? Usually it's the parents that are having a problem for a variety of reasons, right? Like, the baby might just need more help or a little bit slower to that kind of self-regulation, and depending on our kind of our own social supports as parents, and kind of the context that we live in may be really well supported. I think this is where, this is why people who have higher more social support, higher quality social support, will report that their baby has less sleep problems, because they can kind of they're more supported, so they can deal with these hard things. Whereas if you're not supported, or you're experiencing, say, depression symptoms, it's pretty hard. So we know that those things might influence parents' reports of sleep, but we also know that if we can help the baby sleep better, those things can get better. Like, so depression symptoms can decrease, because now you can sleep more than 3 hours at a time. So I think it depends on what aspect you're trying to improve in your intervention. So in my intervention, I'm trying to improve parents' perceptions of their sleep. When we think about, is there an effect on of the NICU environment, like a loud environment, or light, maybe we want to use more precise measurements of sleep. So, that's where we may do EEGs, like little headbands can be used for to monitor the actual sleep states, because they can categorize that more precisely. There's some other kind of more objective or precise measurements, kind of like a research grade Fitbit, where it monitors the movement. But those are sometimes hard to use, and it just depends if it makes sense to be measuring those for what your goal is.
Well, like you said, it all comes back to that, for a lot of these conversations, the parents' perception. And we talk a lot about that, in various elements of the healthcare industry on Preemie Chats, about, something might be interesting from a research point of view, but is it a problem for parents? Is it something that we need to focus on, or is the language that we're using when we're doing it not really the language that parents need or the preemies need? And I think you brought that up so well in your discussion about, what kind of questions we're asking, and I think looking at those kind of steps of when does it really become something that we need to take to the next level, and that there might be an underlying condition or something that we could actually really change, because when it comes down to it, we don't have complete control over things like sleep.
The only thing the only thing you know for sure is that it will change. Like as you're talking about, both our kids are older now, and like there's just new batch of sleep problems. So I think lots of these things are things that if you know the foundational kind of pieces, like there's a wide range in what's normal for sleep duration of people, and that's is across the lifespan. And so thinking about how you can think about sleep, with some of these foundational thinkings, but it's going to change as kids grow.
Yeah. I think that's a fantastic spot for us to end our discussion today. I want to thank you again for your presentation and for the information and the work that you and your group are doing in researching sleep.
Thank you. Thanks, Jenna. It was great to be here. Thanks, everyone, for coming.
Well, and I want to thank again Dr. Elizabeth Keys, who's the lead investigator at the Slumber Research Lab, assistant professor at the University of British Columbia Okanagan campus, for joining me today. You can watch this again on our website, on our YouTube, our social media channels. Please, if you found something interesting and informative today, take a moment and share it with anyone you think might also want to be able to take a look at what we talked about today. You can find all of that, all the links at canadianpreemies.org. I'd also like to take a quick moment to thank our sponsor for the series, AstraZeneca, and to everyone who comes and watches and takes part in the comments and shares and likes these videos. It means a lot. And I want to remind you that Preemie Chats happens every Friday afternoon at 1 p.m. Eastern Time. We'll be back here again next week, and I hope you will join us then. Until then, take care.